If you're living with arthritis, we want you to live better today. We know arthritis is painful and can be debilitating, but our next guest this morning says it doesn't have to be. Welcome this morning, Dr. Tunis Hunt with Hunt for Wellness. Dr. Hunt, good morning. How are you today?
Good morning. I'm doing great. Good to see you.
Good to see you, too. All right, when you mention arthritis, most people associate that with terrible pain and stiffness. What exactly is arthritis?
Yeah, so arthritis is certainly the term associated with joint pain or joint pain disease. And there's actually about 100 different joint diseases out there. And we'll talk about two of the most prevalent ones today. But it affects about 1 of every 5 American adults.
That many?
That many. And it can be very expensive as well. About $150 billion annually on medical treatment and lost wages due to the pain.
Okay, you mentioned the two most common forms of arthritis, rheumatoid arthritis and osteoarthritis. Can you define them and how are they different?
Sure, yeah. So as you mentioned, osteo and rheumatoid are the two most prevalent. Osteo is that classic arthritis that you think about when you're getting older, the aches and pains due to the trauma, the wear and tear of the joint, if you will. And what differentiates that from rheumatoid, for instance, is it affects the distal or the end part of the joint, as well as it can only affect, or it can affect one side versus both sides. Whereas rheumatoid, on the other hand, isn't as a result of wear and tear, but more of the immune system. It's the autoimmune system that kicks into gear. The body mistakes its own tissue for a problem, and in this case, the lining of the joints, and it begins to destroy it. And what characterizes this differently than osteo is it can be both sides versus just one side, and it usually affects the medial part of the joint versus the end of the joint.
Okay, how are most people commonly treated for arthritis?
Well, certainly the most common treatment is medication, and the more prevalent of the two is certainly the over-the-counter medication. So you're looking at the NSAIDs, you're looking at the acetaminophen like Tylenol, things that you can just go pick up at the drugstore. And if it's more severe, you can go to a doctor and you get diagnosed with something and they can give you a prescription medicine. Now, the biggest concern with any medication, of course, is side effects. And in the case of these type of medications, research has shown maybe increase in inflammation or infection or even cancer. And the #1 cause of acute liver failure is acetaminophen use.
Right.
So if you're only doing that, there might be a better strategy out there for you.
Okay, talk about how Hunt for Wellness can help. I mean, what you aim to do in your office is get to the root of what's causing it, not just treating symptoms, but getting to what's causing the pain.
Yeah, and that's a great question, because when it comes to getting healthy, it's all about getting to that root cause. And this is why we dive into this a lot of times in our free dinner talks. And really the underlying root cause is that inflammation. It's that body's systemic inflammation that's been linked to most diseases, including arthritis. And so we try to find that inflammation and we try to bring that down. And some of the approaches that you can use is just dietary changes. So taking away the sugar, taking away the refined carbohydrates like grains, eating organic, eating foods that don't have a lot of the preservatives or human growth hormones and different things in it. Another one is the gut health. We talked about this before, and the bacteria in the gut needs to be the good bacteria versus the bad bacteria. So probiotics or even eating fermented vegetables like sauerkraut or even drinking kombucha can be helpful. And then nutrients like vitamin D levels or omega-3 like fish oil can be very beneficial, or even curcumin, which is found in turmeric, can be a very good strategy of bringing down that inflammation. And then lastly, just lifestyle. Right. So you look at exercise can be beneficial. Chiropractic care has been shown to be very beneficial with that. And then that big elephant in the room, which is stress. And stress is all over the place. And when we have a lot of stress, we get inflamed. It causes a bunch of problems. And so that's why we try to help people manage those for sure.
Yes, we don't want to be inflamed. It's bad all around. And really at Hunt for Wellness, they can help you with that. To learn more about the effects of stress, you wrote something called the Adrenal Code. And viewers, you can download it for free if you go to theadrenalcode.com, theadrenalcode.com. Nice of you to offer that for free.
Our pleasure. We found that's the best way of really learning the mechanism of it and what you can start doing immediately to help it.
And it's the truth that you can start doing things today to feel better.
Absolutely.
It's amazing what your diet will do. You also host free dinner talks. You mentioned that a moment ago. You have one coming up. How can people register for that?
Yeah, so the best way of going is to the website, freedinnertalk.com, or simply visit our other website, huntforwellness.com. And it's absolutely free. We encourage anybody and everybody that wants to learn more about what they can do to empower themselves to get healthy healthy, to come out and join us, and we'd love to have them as guests.
Right. If you're tired of taking medication and feeling crummy all the time, why not give it a shot?
Exactly.
Right?
Just learning what you can do to be your best advocate is really what we're trying to do.
All right, Dr. Hunt, thank you so much. Again, you can visit the website freedinnertalk.com, or you can call Hunt for Wellness. The number is 704-588-1792. 704-588-1792. Great information. Thank you.